Diabetes is also referred to as diabetes mellitus, and may broadly be classified as a category of ailments wherein the person has high blood glucose levels. This could be either because insulin production in one's body is not sufficient, or the body fails to respond to the insulin in the required way. Some of the symptoms that are very commonly associated with diabetes are frequent thirst, hunger and urination. In some cases, diabetes could be a lifelong condition, characterized by high blood glucose levels. The condition is commonly prevalent, and in the year 2013, 382 million people across the world were suffering from the disorder. Type 1 and Type 2 diabetes. Diabetes is very often classified as Type 1 and Type 2 diabetes. When one suffers from Type 1 diabetes, the body ceases to produce insulin. This type of diabetes is relatively rare, and only 10% of people suffering from the ailment are ailing from Type 1 diabetes. Type 1 diabetes is also sometimes referred to as insulin-dependent diabetes or early onset diabetes. And this type of diabetes is more prevalent in people under 40 years of age, even in one's teenage years or early adulthood. If one is ailing with Type 1 diabetes, he has to take insulin injections for the rest of his life, follow a specific diet and also monitor his blood glucose levels by carrying out blood tests at regular intervals. However, Type 2 diabetes is a lot more prevalent type of diabetes, and nearly 90% of people who suffer this disorder are ailing with Type 2 diabetes. When one suffers from Type 2 diabetes, the body does not produce insulin in adequate quantities, or the body cells do not react to insulin, in a condition known as insulin resistance. For many people, Type 2 diabetes is a condition relatively easier to control, and one can keep a check on symptoms of Type 2 diabetes by maintaining one's weight in recommendable limits, making sure that one consumes the healthy diet, getting some regular exercise, and monitoring one's blood glucose levels at regular intervals. Gestational diabetes. An important classification of diabetes is gestational diabetes, which affects women during pregnancy. During pregnancy, women sometimes have blood glucose levels which are more towards the higher side, and their body does not produce adequate insulin to transport this glucose into their cells. Diagnosis of gestational diabetes can be made only during pregnancy, and a vast majority of patients can control their condition by means of diet and exercise. However, 10 to 20% of patients need to take specific medications to keep a check on their blood glucose levels. An important way that can enable one to prevent the condition is by making sure that one consumes a low-cholesterol diet during pregnancy. When do people get diabetes? When one is overweight, he is at a higher risk of developing diabetes. One of the reasons for the same is because when one is obese, the body releases chemicals which can work towards destabilizing body's metabolic and cardiovascular systems. So being overweight, not consuming the right kind of a diet, and developing Type 2 diabetes are all interrelated. Another important factor that is known to greatly enhance the risk of developing Type 2 diabetes is aging. Alternately, some of the other factors that can cause diabetes are genetics, one's family history, or even following an unhealthy diet regimen. Some simple lifestyle changes to overcome diabetes. To keep a check on diabetes, one must avoid skipping meals. This could hike the blood sugar levels, and could even lead to weight gain. Taking care of one's diet is a factor that can go a long way in enabling one keep a check on diabetes, or even overcome the condition. Similarly, consuming a diet which is high on fruits and vegetables can help control diabetes, because fruits and vegetables are full of fibers. This helps us keep full, and the high vitamin and mineral content in fruits and vegetables helps ensure that the body receives nutrition. This keeps one energetic, and one is not tempted to go for sugary foods. As a rule, one must avoid all foods which have a higher glycemic index, like chips and salty snacks, and one must keep a check on consumption of fatty foods as well. Similarly, starches from white rice, potatoes and whole grains could also influence diabetes. Something as simple as drinking 6 to 8 glasses of water every day is a factor which can go a long way towards prevention and control of diabetes. In the same way, even a slight weight loss can work wonders for someone who is a diabetic. While being the healthiest way to get over diabetes, a slight weight loss of up to 5 to 10% can have the same effect on a diabetic as anti-diabetic pills. And if you are considering getting some good exercise, walking stands out as one of the best options. Walking reduces risk of many ailments like diabetes, dementia and osteoporosis. This keeps the heart stronger and also helps you lose weight.